Welcome to today's webinar titled Ambient Non-Methane Hydrocarbon Levels Along Colorado's Northern Front Range, Acute and Chronic Health Risks. I'm Kim Schultz, the Oil and Gas Program Coordinator with TEDx, the Endocrine Disruption Exchange. TEDx is a science-based nonprofit research institute, and our mission is to reduce the use and production of chemicals that interfere with healthy hormone function. This webinar is part of an ongoing series inviting scientists to present their research addressing health effects associated with unconventional oil and gas development. We welcome any comments or suggestions. Contact us by going to our website at tedx.org. It is my pleasure today to introduce our speaker, Dr. Lisa McKenzie. Dr. McKenzie is an assistant research professor at the Colorado School of Public Health. Her expertise is in exposure assessment, environmental epidemiology, and human health risk assessment. Her studies investigating associations between adverse birth outcomes and childhood cancers and proximity to oil and gas development are among the first epidemiological studies on this topic to appear in the published literature. Her Sentinel Human Health Risk Assessment indicated the potential for respiratory, neurological, and developmental health outcomes resulting from exposure to air pollutants emitted during natural gas development. Thank you so much, Dr. McKenzie, for presenting your research, and I'd like to turn it over to you.
Thank you, Kim, and I'd also like to thank the Endocrine Disruption Exchange for inviting me to share our most recent work on the health risks associated with oil and gas development in residential areas. Our risk assessment was funded by the National Science Foundation, and sampling support was provided by Boulder County, NASA, NOAA, and NCAR. I'd also want to thank my co-authors and those that helped us collect the air samples. And there were a lot of people involved in this study, and like all research studies, it takes a lot of people to carry these off. In this study, we used results from ambient air samples that were collected across Colorado's Northern Front Range in the summer of 2014. And we used these results to assess health risks to people living at varying distances from oil and gas sites. We considered health risks associated with short-term exposures to high concentrations of hazardous air pollutants, as well as long-term or chronic exposures to lower concentrations of these hazardous air pollutants. Hannah Halliday's benzene results, which are shown here, were one of the things that motivated us to do this study. This figure shows benzene concentrations in relation to oil and gas development along Colorado's Northern Front Range. The oil and gas wells are depicted in orange here, and the ambient benzene concentrations are depicted with these circles. The highest concentrations are shown in the yellow colors, and the lowest concentrations are shown in these pinkish purple circles. You can see here that the benzene concentrations that were measured in the area with the most oil and gas development right here are about twice the concentration on average as those measured at sites with no oil and gas wells, such as in Fort Collins and down here around Golden. As part of her study, Dr. Halliday monitored benzene concentrations for a month at this central site right here, right in the midst of the oil and gas development. And one of her observations from that study was that there was a diurnal trend in benzene. And in this figure, the benzene concentrations in parts per billion are shown here along the y-axis, and the month of sampling, the dates, are shown here along the x-axis. And you can see this repeated peak exposures of benzene, and these peaks were occurring before sunrise in the very early morning hours. And there were several occurrences where the benzene concentrations were higher than 9 parts per billion. And 9 parts per billion is the minimal risk level for acute exposures to benzene, and that was set by the ATSDR. So we were concerned about the potential for high short-term exposures to benzene, because before sunrise or these early morning hours are when people are most likely to be home. Another motivation for our study was the extensive air sampling conducted along Colorado's northern Front Range in the summer of 2014. This figure shows where samples were collected in relation to oil and gas wells. So on this figure, the dark blue colors here, once again, are where the most dense oil and gas development is occurring, and then the green is a little less dense, yellow is fairly sparse, and then white areas, there's almost no development. Dr. Halliday's sampling locations was right here where the star was. There was also another fixed sampling location run by the Colorado Department of Public Health and Environment here in Platteville. And then the circles depict where the University of California, Irvine, collected 1-minute grab samples, and they did those in areas of varying levels of oil and gas activities. And then finally, we had samples that were collected right along the border of the intense oil and gas region. These were 76 to 96 hour integrated canister samples, and then one more sample that we used that was collected in Boulder County, or Boulder City, the city of Boulder right here. As shown here, what we did with these samples was we grouped them by the distance the sample had been collected from the nearest oil and gas facility. And we considered the groups based on Colorado's setbacks, and a setback is the distance that an oil and gas well can be located from a home, and then distances that have been considered in previous literature. And our exposure groups, or our scenarios were, the first one was all the samples that had been collected within 152 meters or 500 feet from the nearest gas well. Our second group was samples that had been collected at a distance of greater than 500 feet to about 2,000 feet. The third group was samples that had been collected between 2,000 feet and 1 mile. And our last group was samples that had been collected at a distance of greater than 1 mile from the nearest oil and gas well. We used California's Office of Environmental Health Hazard Assessment guidance for our risk assessment. And we chose to use this guidance because it considers some of the most current toxicity information for benzene, and it also considers lifelong effects from exposures to air pollutants and includes the gestational period and the exposure. We also accounted for higher nighttime exposures with time-weighted averaging because most of our samples were collected during the daytime. In addition, we only considered exposure to hydrocarbons in this risk assessment because that's what the results were in the summer of 2014. We did not assess other things that may be associated with oil and gas development, such as ozone, particulate matter, or carbonyls. Additionally, for the acute short-term exposures, we used the maximum concentration that was detected in either Dr. Halliday's fixed site or in the 1-minute grab samples. For the chronic risks, the longer-term risks, we used average results from the 1-minute grab samples and the 3 to 96 hour integrated samples. For the chronic exposures, we also assumed that someone was exposed to the hazardous air pollutants for 24 hours a day for most of the year for more than 7 years. And for our cancer risks specifically, we assumed that people spent 72 to 85% of their time at home over a 30-year period. And the percentage of time they spent at home was based on their age. So children, very young children, spending a higher percentage of their time than older children and adults at home. So to move on to the results of the risk assessment, I first want to talk a little bit about the concentrations of the hazardous air pollutants that we observed in the samples, and I'll start with the 1-minute samples that were collected by the University of California, Irvine. What's being shown in these figures is distribution with what is called a violin plot of the results for our hydrocarbons, benzene, some of the alkanes, toluene, ethylbenzene, and xylenes. Concentration is on a log scale here on the y-axis, and our different exposure scenarios are shown along the y-axis. And what you can see in these figures is that for all our hydrocarbons, the highest concentrations were observed in that exposure scenario of less than 500 feet from an oil and gas site. And this is much higher, because remember, this is on a log scale, than the concentrations that were observed at a distance of greater than 2,000 feet. And that same comparison is true for all the hydrocarbons presented here. We also did the same kind of comparison from the results in the integrated samples. Once again, these are violin plots. And what we see here is we don't see that big difference between the sampling locations, but overall we see that the lowest concentrations of the hydrocarbons were observed at the Boulder site. So in Boulder, there weren't any oil and gas wells, but the site was near a very busy intersection and likely had a high traffic influence in those samples. So now I want to talk to you a little bit how we use these concentrations measured in the samples in the risk assessment. So to think about the non-cancer potential, we first start with a dose at which either in an animal or a human study, there was either no effect or the least effect was observed in the study. And while we do use human studies when this information is available, it's very rare that this is available for a human study. This is usually an animal study that we're using. So we take that dose at which there has been no effect observed in the animals, and then we divide that dose by uncertainty factors. And we do this because, first of all, we have to extrapolate from an animal to a human population. And then also we do that because there can be quite a bit of variability of response within the human population. And this equation yields what we call a reference dose. And sometimes the reference dose is also referred to as a safe dose. We then compare the exposure concentration that we observe from the sampling to that safe dose. And this quotient from the comparison is called the hazard quotient. And if the exposure concentration is less than the reference dose, the hazard quotient will be less than 1. And if this is true, we assume that it is unlikely that a health effect would occur from that exposure. However, if the exposure concentration is higher than that safe dose, as shown here, or greater than 1, we would assume that the possibility for a health effect does exist. So let's look at what the results were from our study. On this graph, you can see each of these bars shown in different colors is each of the hazard quotients for each of our hydrocarbons. We then summed the hazard quotients together, so all of these together, to come up with what we call a hazard index. And the hazard index is interpreted in the same way as the hazard quotient is. So hazard indexes that are greater than 1, we assume the possibility for health effects might be occurring. If it's less than 1, then we assume that the possibility for health effects is unlikely. And what you can see here for both our chronic and acute exposure scenario at a distance of 150 meters or 500 feet, the hazard index is greater than 1. And this is based on the 1 minute and 1 hour sample results. We did the same type of assessment for the integrated sample results. And as for our 1 minute sample results, and I forgot to say on the previous slide that benzene is driving all these results. Also here, once again, benzene shown as in blue is driving these results. But in this case, we only have one instance in which the hazard index is greater than 1, and it's only slightly greater than 1. And that is from those samples that were collected right along the boundary of the intense area of oil and gas development. That was in eastern Boulder County. Now I want to present to you the results from our cancer risk assessment. And before I do that, I think it's really important to keep in mind what this means. And so there are 1 million people represented here on this slide. And approximately the background risk for Americans of getting cancer is 400 in a million. So this yellow portion of the slide, this is how many people are predicted to get cancer in their lifetime. The excess cancer risk that we're talking about in the risk assessment is the additional cancers in addition to this background cancer risk, which is represented right down here in this small area of magenta. And EPA has 2 thresholds that we consider when looking at this excess lifetime risk. The first is if the excess lifetime cancer risk is less than 1 in a million, that is considered to be a minimal or a de minimis risk. If it's over 100 in a million, that is considered to be a significant cancer risk. And if it falls between these two, then that cancer risk is evaluated on a site-by-site basis. So what we found in this study, showing our exposure scenarios here and our excess lifetime cancer risk here along the y-axis on a log scale, was we found that all of the cancer risks, even those greater than a mile from the oil and gas sites, were greater than EPA's de minimis cancer risk. And this was being driven by exposures to benzene in all scenarios. We also found that people living within about 1,000 feet or 247 meters from an oil and gas site, this excess lifetime cancer risk was approaching EPA's upper threshold of 100 in a million. And for those within 500 feet, the excess lifetime cancer risk was 8 times higher than EPA's threshold. So our study had some strengths. We were able to evaluate realistic residential exposure scenarios. All our samples were collected at places where people could be living, and they were collected at a height where people could be breathing. We were able to incorporate a lot of spatial and temporal variability in our assessment over the summer of 2014, and we were able to consider these exposures to short-term high exposures to some of these hazardous air pollutants. We also had a reference site that included traffic influences, so we were able to look at the additional risk from oil and gas sites. And finally, our findings were consistent with published epidemiological studies and risk assessments. We also had some limitations, like most risk assessments. The amount of toxicity information that is available is limited. It's not available for all chemicals, and it is oftentimes limited to animal studies. We were not able to assess all of the air pollutants associated with oil and gas development, and most of our samples were collected in the daytime, and our time-weighted averaging may or may not have really fully incorporated the nighttime exposures. Finally, we only looked at one season, summer, and there have been studies that have shown that the concentrations of hazardous air pollutants in the air could increase in the winter season. So the reason why these results are important is that tens of thousands of people in Colorado are living within 500 feet of an oil and gas well site. And we estimated the cancer burden in this population within 500 feet of the well sites would be 14 additional cancers over a lifetime. It's also important to consider that this population living within 500 feet of an oil and gas well site is growing at a faster rate than the general population. So as this population increases, the number of additional cancers would also be that would be predicted would increase. Also, Colorado currently regulates the distance a well can be located from a home, and this is known as the setback distance, at 500 feet. However, there are no state level regulations on the distance a home can be located from the existing oil and gas well. A developer can build a home closer to a well. Also, setbacks are not in place for all types of oil and gas sites. On the wells that are existing, Boulder County has found that the older and smaller oil and gas well sites are more likely to have leaks and equipment malfunctions. And that most times these are not detected by the traditional method for inspecting these sites. And the traditional method for inspection is for an inspector to go out there and to listen and look and smell to see if they determine anything. Recently, Boulder has updated this requirement that they have to take out an IR camera to actually do some of this. So in conclusion, this study supports and highlights the importance of policies aimed at reducing or eliminating air emissions from oil and gas sites. This is particularly important for oil and gas sites that are located near people's homes. So at this point, I'd like to stop and allow some time for questions. Thank you.
Oh, thank you so much for your presentation. Thank you for making it very accessible. It can be, there's some dense material in there, and I really felt like I understood it. So thank you for that. There are a few questions. If you go to the Q&A box, I don't know if you can see that. You can see the question, but I'll read it to you as well. So the first question is, how do the California risk assessment guidelines differ from the EPA guidelines?
Okay, the reason why we use the cancer risk assessment guidelines is they are more current than the EPA guidelines. The EPA guidelines were last published in 1989, and EPA's toxicological profile for benzene was published in 2002. The EPA methods have incorporated more recent toxicology information that was not available in 2002 for that EPA risk assessment. And since benzene is one of the primary drivers of our risk, we felt it was important to include that more current information on benzene. The other reason we use the California risk assessment guidelines is they do incorporate that full range of exposures, or the full lifetime of exposures, including the gestational period, which EPA's guidelines don't currently include the gestational period.
Thanks. Okay, great. Next question. How can people in Colorado live closer than 500 feet from a well when the setback is 500 feet?
Yeah, I talked about this a little bit in the presentation, but this gives me an opportunity to talk about it a little bit more. So historically, the setback distance between a well and a home in Colorado was as short as 150 feet. So this new setback distance of 500 feet was introduced in 2012. So there were already a lot of people living near existing wells much closer than 500 feet. The other reason for this is that home builders can build homes close to existing wells, closer than 500 feet. There's no regulation on that. Some local jurisdictions have some zoning codes on that, but they all don't. And finally, if a home is built closer than 500 feet from a well, it negates some of the protections of the 500-foot setback. They can go in and put more wells on that site at that point because the site already exists.
Well, I did notice on your slide you had something about reverse setbacks. Can you explain that?
So the reverse setback is when we're referring to where a home builder builds a home. So that's when the home builder puts a home near an existing well rather than a well being built near an existing home. So it's opposite.
Thanks.
Yeah.
Are there other relevant specific endpoints besides cancer for which risk assessments like this one could be created?
So in what we traditionally do in risk assessment is we look at the cancer risks and we look at the non-cancer risks, which we did here. So we grouped all those non-cancer risks together. But you can also do them for specific endpoints. You just need to have toxicology information available for those specific endpoints. So if you had an animal study or a human study that said exposure to this particular chemical causes this health effect at this concentration, you could do something very similar to what we did here.
Okay, thanks. And we have another question. What do you think is a safe setback? Can this be, or can the exact distance be determined scientifically, or is it a matter of how much risk you're willing to accept?
So I often get asked this question, and my answer is I don't know if there is one safe setback. I don't know if there's going to be one answer to this question. I think it's going to depend on many things. Like the person that asked this question, I think it partly has to do with how much risk you're willing to accept. There is nothing that is absolutely safe. I think we all know that. There's always some level of risk. But it's also going to have to do a lot with the vulnerability of the particular individual, and it's going to have to do with what else they're being exposed to. So what might be a fairly minimal risk setback in an area with no other sources of air pollution may not be the same as a setback distance in an area with a lot of other oil and gas wells in it or other sources of pollution.
Great, thanks. And it looks like we have one last question here. Do you think benzene is the primary chemical of concern, or are there many others?
I think benzene is the primary chemical of concern that we have identified thus far. So most of the measurements that have been made around these sites have been for what we call the non-methane hydrocarbons, or the hydrocarbons. Sometimes they're called aliphatic compounds or aromatic compounds, and that's mostly what has been measured. However, we do know that there are other chemicals used at these sites and emitted sometimes from these sites that aren't typically measured. So whether or not one of them is a primary chemical of concern, we just don't know, because I don't think we have the measurements to make that decision.
Okay, well, I noticed one question I have.
Mm-hmm.
I noticed on your slides that you had a few different chemicals mentioned when you were doing your hazard index. And do you think so how did you choose those chemicals?
Well, those chemicals were chosen based what they analyzed for in the samples. So they did analyses for hydrocarbons, and that's a specific type of analysis that you do. You can also do another type of analysis for compounds we call carbonyls, and those include things like have been raised in other studies, things like formaldehyde. I know it's been raised in concern around these wells, but we didn't have those measurements, and that's often not determined around these sites, so there's not a lot of data on formaldehyde. Another chemical that could potentially be of concern that has not been measured out in the residential areas very much is some of the sulfur containing compounds like hydrogen sulfide. We just don't really know at this point. There's just not many measurements. I mentioned ozone. Ozone is a secondary air pollutant that's probably more of a regional concern in these areas, so more widespread and regional. The hydrocarbons emitted from oil and gas development can contribute to regional ozone formation.
So if you did have those additional numbers, could that potentially move your bar a little further to the right?
So if we had results for those chemicals, it could either keep the bar in about the same place or move that hazard index further to be above 1 or further above 1. It would not move it to be smaller.
Okay. Thank you. Well, thank you so much for answering all these questions.
Sure.
And yeah, thanks to everyone for listening today. You can learn about future webinars by signing up for our weekly e-blasts on our website at tedx.org, subscribing to our YouTube channel at the Endocrine Disruption Exchange, or following us on Twitter. We have recordings of previous calls and webinars on our website. And I'd like to thank you again, Dr. McKenzie, for taking the time to present your research, and thank everyone who's watching this for taking the time out of your day. Have a wonderful day.